Hello everyone, welcome to my today's presentation. Just our today's presentation will focus on induced abortion, including the important points that need to be considered, including the indications for induced abortion, the techniques to be used, and the important things to be considered in induced abortion. So let us start with this case scenario. So the case scenario reads as Mrs. E is 17 years old and she alleged pregnant due to rape, and she has mental disorder and is economically dependent on begging, and she also has persistent heart disease and invasive cervical cancer. On ultrasonography examination, her fetus has gross heart defect. So the question comes now. It says, if she requests for induced legal abortion, how many criteria for legal abortion on Ethiopian Constitution Article 551 does Mr. E fulfill? So A 1, 4, C 2, D 5. The next question says, does fulfilling only one criteria of the Article 551 is enough to be eligible for induced legal abortion? So if you, the audience of this video teaching is from Ethiopia, let you consider the criteria that are listed in the Article 551 of Ethiopian Constitution. But if you may be from other country, let you consider the criteria for induced legal abortion in your country's constitution. Let us proceed. So the next question says, Ms. D is 21 years old pregnant woman and her pregnancy is 20 weeks when calculated from her last normal menstruation period. When I say last normal menstruation period, I'm saying that menstruation period is reliable, so that the gestational age you are considering here is reliable and true. So on ultrasonography anatomical scanning, her fetus has anencephaly. So is Ms. D eligible for induced legal abortion as per Ethiopian Constitution? Yes, because her fetus has anomaly and is incompatible with extrauterine life. B, no, because anencephaly is simple anomaly and can easily be treated. So what's the answer? Let you answer it by yourself. It will be answered at the end of this presentation. The other thing is surgical or medical abortion is preferable method for Ms. D if it is determined that she can have induced legal abortion. So surgical method is preferable. Why? B, medical method is preferable. Why? So let you answer this question by yourself. We will discuss it in detail and it will be answered at the end of this session. So you need to follow this presentation until it is end. Welcome. The third case, Ms. X had one lower uterine segment transverse cesarean section during previous delivery. Currently, she is 13 weeks pregnant woman and requested induced legal abortion for pregnancy resulted from a rape. So, if she preferred medical abortion, which of the following is appropriate for her? A. Mifepristone 200 mg 24 hours, followed by 200 microgram of misoprostol 5 doses every 4 hours. B. Mifepristone 200 mg 24 hours, followed by 400 microgram of misoprostol for 5 doses every 4 hours. And the other C, mifepristone 200 mg, just following after waiting for 24 hours, followed by 800 microgram. So just this is considered as loading dose, followed by 400 microgram of misoprostol 5 doses every 4 hours. And this says only loading dose should be omitted. So what's your answer? This is very critical question that have very important clinical implication significance. So you need to critically know it. So you will find it within our this presentation. So let you follow me attentively. So let me start with defining what induced abortion is. Induced abortion is termination of pregnancy either by medical or surgical method before the time of fetal viability. So when we say induced abortion, it is artificially initiated. So it is termination of pregnancy either by medical or surgical method before the time of fetal viability. So that if this method is performed after expulsion from the uterus, the will be delivered. Fetus can't be survived. Yes, external life. So, what are the indications for induced abortion? The Article 551 of Ethiopian Constitution indicates 5 criteria. The first one, if pregnancy resulted from rape or incest as disclosed by the woman. So, if the woman coming for requesting for induced abortion reported as the pregnancy resulted from either rape or incest. When we say rape, just forceful sexual intercourse without the consent of the woman. And when we say incest, if either it may be with consent or not, but if it resulted from close relatives. So in this case, the only report of the woman saying this pregnancy resulted from rape or incest, just you, the healthcare provider, no need to investigate it anymore. Just the report of the woman is enough. So the other thing, if the age of the woman is less than 18 years, so the Ethiopian constitution allows this kind of women, pregnant women, to have abortion if they want. The other thing, if the woman have medical condition threatening the woman's life if pregnancy progress, but this kind of medical condition should be confirmed by the attending health professional. The other thing, the fourth criteria, if viable birth of the fetus with a significant anatomical or mental deformity, in this case it is okay to have rape. The other thing, and the fifth, the last criteria, just if the woman, the pregnant woman, is unable to grow up the will be delivered baby as a result of extreme poverty or mental illness. So these 5 criteria are the criteria listed on the Article 551 of Ethiopian Constitution and are adequate for having legal abortion. So if a woman have only one of these criteria, it is enough to have rape. I mean, to have induced abortion. So the combination of more than one is also possible, but only having one single criteria listed here is adequate for having induced legal abortion in Ethiopia. Let us proceed. So, before performing the abortion procedures, what are the pre-procedure evaluations? The first one, it should include counseling. When we say counseling, counseling should be focused on just if the woman may change her decision since abortion is inhuman. So every human being, so when we consider counseling, as counseling is all about enabling the woman to have all necessary information that help her to decide her right on decision, just it should be focused on so counseling, if for example, if the woman decided to have induced legal abortion, if just the pregnancy resulted from rape or incest, or if she is just minor age, if her situation permits just peaceful or healthful birth, so that, for example, and if there are options by which she can give her will be a born baby for adoption, just we should have to counsel her on this area. For example, if we can arrange adoption, people who want to have the well-born baby of the woman who is asking for induced legal abortion, yes, we should have to inform the woman. The decision is her own. The other thing, all about informed consent. focus the history is must, and the other thing, limited physical examination and lab investigation. We will see one by one. So, in terms of history taking, the history should focus on relevant data such as gynecologic problems, example, leiomyomas, the other medical problems, whether there are cardiac disease, asthma, drug sensitivity, that might influence the course of operation. For example, if the woman have leiomyoma, it is abnormal growth within the uterine cavity, it will can lead into excessive bleeding. So there must be another arrangement to just deal with the situation. So it determines the way how the procedure of the will be undertaken. Abortion procedure should be taken. For example, if the woman is allergic for misoprostol or other prostaglandin drugs, it determines the technique we will use. So our history taking should focus on relevant data such as gynecological problems and medical problems, as I have listed here. The other thing, physical examination should include about heart, just the wellness of lung, abdomen, and pelvis. Specifically, when we consider physical examination on pelvic area, it should determine the size of the uterus and also the shape of the uterus. For example, if the uterus is retroverted, it is difficult to undertake just the procedures considering as normal. The specific arrangement should be there. So the physical examination should have to, just on the pelvic part, it should have to identify the size of the uterus and the shape of the uterus. So in case if on physical examination, specifically the pelvic part, it is just difficult to identify the shape and the size of the uterus, ultrasonography is best to determine the size, the shape, or the position of the uterus. So laboratory tests should include hematocrit, blood group, and RH. So if hematocrit, if the woman of if she's anemic, just she's finding will help us. So in case if the woman may need blood transfusion, just this lab investigation will help us, either hematocrit or hemoglobin. Just the other thing is blood group. If the woman may need blood transfusion for cross-match purpose, the other thing RH type. Same for cross-matching, and also if the woman is RH negative and if she is unsensitized, anti-D-gamma globulin should be given. So we will see the dose of anti-D immunoglobulin as the last of this presentation. Let us proceed. So what are the techniques or the methods to be used for induced abortion? Generally, medical and surgical methods are commonly used. So the techniques to be used depends on the gestational age, the age of the pregnancy. So if the pregnancy is within the first trimester, that means if gestational age is less than 12 weeks, surgical method, specifically MVA or dilation and curettage are commonly used, but MVA is the preferable method. So if the woman is nullipara, when I say nullipara, if the woman hasn't ever delivered, so priming the cervix with misoprostol, 400 microgram vaginal dose, and 4 to 6 hour waiting just for performing the MVA. So here, just it is all about, when we say priming, it is all about preparing the cervix for dilation. So we should have to give 400 microgram, 2 tablets of misoprostol vaginally under the posterior fornix of vagina, and then we should have to wait here just for 4 or 6 hours and just proceeding performing the manual vacuum aspiration. So it is done in OPD, that means outpatient department, no need to admit the patient to hospital. So in this procedure, since the procedure is somehow painful, analgesic drugs such as tramadol, diclofenac, or petadine intramuscularly should be given 15 to 30 minutes before starting the procedure. And so if the pregnancy is just within the first trimester, and just what we have seen before is surgical method, but medical method is also applicable if the pregnancy is less than 9 weeks. With Misoprostol 200 microgram PO, just followed by Misoprostol 800 microgram after 36 up to 48 hours once vaginally, and follow in health institution until 4 to 6 hours. So the reason why we need to follow the woman in the health facility for 4 up to 6 hours is in case of greater than 95%, the expulsion or product of conception occur within the first 4 hours up to 6 hours after taking this dose. So in this case, no need to repeat the dose indicated here. Only one dose is enough. That means in 95% of case expulsion occur within this hour. So medical abortion are safe, effective, non-invasive, and have minimal or no complication when we compare it with the surgical method. So it is better to use medical abortion rather than the surgical method. So when we come to the second consideration, if the gestational age is in between 13 to 24 weeks, surgical method, either dilation and evacuation, is commonly used. So when we consider the gestational age, if the gestational age is in between 18 up to 24 weeks, dilation and curettage with or without cervical preparation can be done. So for cervical preparation, misoprostol 400 microgram vaginal dose, just as we have seen on the first trimester abortion. And the other thing, since the procedure is painful, just intramuscular analgesics, local or regional anesthesia to reduce pain should be done. The other thing, patient require admission to ward for preparation and procedure. So in this case, patient need to be admitted to the hospital. But in the first trimester, just not. It can be done at OPD level. Let us proceed to the medical part, medical abortion method part. So in medical abortion, for second trimester abortion below 24 weeks of gestational age, oral misoprostol, oral mifepristone 200 milligram followed by after 24 hours, followed by loading dose of misoprostol. So if it is vaginal, 800 microgram, but if it is sublingual, but the dose should be reduced by 1 tablet, so 600 microgram should be given. With subsequent vaginal or sublingual, or just as I have said here, and then after staying for 4 hours, 400 microgram of misoprostol dose should be given until expulsion of product of conception or up to 5 total increases as the dose increased, as the dose of misoprostol increased. That's why. So after fetal expulsion, give a woman a uterotonic agent to help the uterus contract. So just the dose is here. Let us proceed again. If expulsion has not occurred after 24 hours and uterine rupture has been rolled out, the following may be taken. Repeat the original regimen after at least 12 hours or less. So I mean, you started administering mifeprostol 200 microgram, you waited for 24 hours, and then you have given the loading dose 800 microgram if vaginally, or 600 microgram of misoprostol sublingually. You waited 4 hours again, you administered 400 microgram, you finished 5 consecutive doses, no expulsion. So in that case, just repeat the original dose after at least 12 hours of rest. Allow the woman to have rest, and then re-repeat the original dose. That is it. If the other option ruptures the membrane and continues the original regimen, just as here one. The other thing, use high dose of oxytocin. Administer 200 international units of oxytocin in 500 milliliter of normal saline or ringer lactate solution, administered at 50 milliliter per hour IV until expulsion or maximum dose of 24 hours. So to avoid water intoxication, stop the infusion for 1 hour out of every 4 hours and monitor fluid status and urine output closely. Let us proceed. How to deliver placenta. In case if some part of the fetus expelled and just if the placenta remained in, use controlled contraction for placental removal. So controlled contraction is all about applying your left hand on suprapubic prayer, just limiting the uterus where it is, and then when we say traction, it is all about pulling the cord. So in this case, our focus is to prevent uterine inversion. So the other thing, and just this is what the description of what I've said now. So if the placenta remains in the uterus, there are a few options. One, use buccal, that means sublingual, oral or rectal, misoprostol 400 up to 800 microgram. So you should have to reduce the dose when you administer misoprostol buccally or sublingually, because if you give some high dose buccally or sublingually, the woman will develop a shivering. So just you should have to reduce dose in this case. So if it is rectally, you can, or orally, you can use 800, but it is better to use 400 microgram if you administer the misoprostol dose sublingually or buccally. That's it. So the other thing, attempt a sponge streak expulsion. If the cord is torn or if the placenta cannot be expelled, use MVA or curettage, just depending on the situation. The other thing, what to do after expulsion of product of conception. After expulsion of fetus and placenta, insert a speculum and gently wipe blood clots from the cervix and visually confirm that there are no lacerations. And then examine the placenta and the fetus to confirm that expulsion was not complete. In case if fragment of the placenta remained within the uterus, and if some fetal parties, including the fetal membrane, retained within the uterus, the woman will develop septic abortion, or she may bleed profusely, but the remnant of placenta or fetal part or fetal membrane within the uterus exposes the woman to develop septic abortion. In that case, it may lead the woman to die after sepsis. So you should have to examine the completeness of the delivered placenta and the fetal part, including the membrane. So this is very critical issue. So you should have to examine it. You should have to confirm it is completeness. If what expelled is not complete, you should have to explore it again. Explore the uterus again. The other thing, cover the fetal tissue so it is out of the woman's sight. Follow a local protocol for disposal. Here, you need to hide the expelled fetal parts from the sight of the woman, because whatever it is, whatever situation enforces the woman to decide you should have to abort her conception, whatever it is, what is being expelled, what is being cut off is her fetus, it will be child. But if she see it do have very devastating psychological impact on her, so it may lead the woman to develop just psychological problems, so that you should have to hide the fetal parts from the sight of the woman. So that is it. So just after full expulsion, you should have to strictly follow the protocols of the area where you are working. Whether in some case it should be disposed within the hospital, in some case the family members may need just to take it to bury it with themselves. So just what is being followed in the local area should be strictly followed here. The other thing, what are the general considerations during induced medical abortion? One, assess patient status and the presence of complications every time. So every time misoprostol is administered and after expulsion of product of conception and whenever indicated. So you should have to assess the patient status and presence of complication. Just after misoprostol is every time misoprostol is administered after expulsion of product of conception whenever indicated. Oral analgesia should be started after misoprostol administration. No, here, before. This must be before. So oral analgesia should be started before misoprostol administration because just misoprostol mechanism of action is it softens the cervix and it induces the uterine contraction. So in this case, it leads into painful situation. So just to reduce the pain, just analgesia should be given before misoprostol administration. Patient admission until misoprostol administration depends on her willing. So if the gestational age on which the woman requested for induced abortion is in between 24 up to 28 weeks of gestational age, use oral mifepristone 200 mg followed 24 hours later by vaginal misoprostol 400 microgram every 6 hours until expulsion of fetus or up to 5 total doses. So here what is missed is using the loading dose. No loading dose here. We have seen before. So extraction of fetus or total breech extraction followed by controlled contraction can be done with dilated cervix. Generally complications tend to increase with increasing gestational age. So the attending clinicians should be very careful about patient evaluation and follow-up. So let us look at this special consideration. For example, if the woman's uterus is scarred before, just if only one lower uterine segment transverse cesarean section done, except for the first trimester, in all other cases of medical abortion, misoprostol dose should be half of the recommended dose for the respective gestational age without scarred uterus. The loading dose of misoprostol should be omitted. So, if there are two or more lower uterine segment transverse cesarean section scars and scars other than the CS in the second trimester abortion, surgical method including dilation and evacuation and hysterectomy should be used. Medical abortion is contraindicated in this case because if medical abortion is done, just the drug we use is uterotonic drug, so that it causes the uterus to contract and retract. In that case, the uterine rupture may occur again. So, if the woman have two or more cesarean section, lower uterine segment cesarean section, scar, or other kind of operation on the uterus, using the surgical method is preferable. So, using medical abortion is contraindicated in this case. Let us proceed. So, experienced provider and specialized equipment is required when during the second trimester abortion. So, in different health centers in Ethiopia, just second trimester abortion is not to be done in the health center facility because just the health center setup lacks specialized equipment and skilled personnel in the health center. So second trimester abortion should be done in hospital setup because just specialized equipment and experienced provider are expected to be available in hospital. So in Ethiopia, just second trimester abortion should be done at hospital. The other thing, prevention and management of breast engorgement, because if the pregnancy is within the second trimester, that means if it is in between 12 weeks up to 28 complete weeks of gestational age, we call this second trimester abortion. So in this case, starting from 16 weeks, just breast maybe engorges. So the prevention method and management method for breast engorgement should be undertaken here. So the woman should be counseled on preventing breast stimulation, on using cold compress, and having tight breast area. The other thing, transient fetal survival may occur after medical abortion at greater than or equal to 18 weeks of gestational age. So, just if that means after expulsion of fetus, if fetus delivered or expelled alive, in this case, it could cause anguishing feeling on the woman and also the provider. So, just the methods to induce fetal demise may need to be used. So the two most common methods of inducing fetal demise are, inducing fetal death after deciding abortion are two. One, administering intra-amniotic or intrafetal digoxin 24 hours before induction of the abortion, or administering 5 milliequivalent fetal intracardiac potassium chloride immediately prior to the procedure. So to prevent engaging failing on the woman and also on the clinician, just this method should be done during the second trimester abortion, especially if the gestational age is greater than or equal to 18 weeks. So let us come to looking at the post-abortion care. Post-abortion care include contraception, especially after unwanted pregnancy. If unwanted pregnancy just occur as a result of rape, as a result of incest, whatever, using contraception is very important. So for unsynthesized RDH negative mother, giving anti-immunoglobulin 50 microgram, just microgram for first trimester abortion. It is during the second trimester abortion using 700 microgram is must. That means if the woman is Rh negative and if the blood of the fetus is Rh positive, in this case the risk of sensitization is high. So that to prevent sensitization, just this drug must be given. The other thing, counseling and linked with other Rh service, creating partnership with community as possible. That is it. Let us consider the case scenarios we have seen as a beginning with this presentation. So, the first case, Miss E is 17 years old. She is pregnant due to rape. She has mental disorder and economically dependent on begging. So, she also has persistent heart disease and invasive cervical cancer. On ultrasonography examination, her fetus has gross heart defect. So how many criteria is listed on 551 article of European Constitution for induced abortion this woman fulfill? One, she's minor, within minor age. That means she is less than 18 years. One criteria is one. The other, she alleged pregnant due to rape. Two, the other, she do have mental disorder and economically dependent on begging. Three criteria. She have medical condition that puts her at risk for death if the pregnancy continues. Four, the fetus has also gross heart defect. So just this is also the other criteria. Five. So the answer is five. That's fulfilling only one criteria of Article D is enough to be eligible for medical abortion. Yes. We have seen in the first part. The second case, Mrs. D is 21 years old, pregnant woman. Her pregnancy is 20 weeks when calculated from her lateral menstruation period. On ultrasonography, anatomical scanning, her fetus has anomaly, which is anencephaly. So, is Mrs. D eligible for induced abortion? As per Ethiopian Constitution, yes. The answer is yes, because her fetus has anencephaly, and having anencephaly means just lacking the part of brain and also skull. So there is no cure for anencephaly. So that is it. The other thing is surgical or medical abortion method is preferable. As we have seen before, medical abortion is safer, non-invasive, and just it's preferable for her. The third case, Mrs. X had one lower uterine segment transverse cesarean section during previous delivery. Currently, she is 13 weeks pregnant woman and requested induced legal abortion for pregnancy resulted from rape. So here, what the reason she have for having an induced abortion is rape. So it is if the woman alleged pregnancy is as a result of rape, no need to take further investigation. So the questionable will be the person who is going to investigate it more. So it is enough criteria. Just if the woman alleged rape as a cause for pregnancy, okay. So our focus is if she preferred medical abortion, which of the following is appropriate for her. As we have seen before, if the woman have one lower uterine segment transverse, she has no other uterine scar, the loading dose should be omitted, and also the usual dose should be made half of the dose to be given for general population. So this is the answer. The others are not. Thank you a lot for your attention. The next session is soon to come. Plus, never forget subscribing this YouTube channel. My YouTube channel says Kayev YouTube channel. Never forget subscribing it. Thank you so much. Thank you so much.